Ever feel like your smartwatch is just like spitting out these numbers, that you don't really understand?
Yeah.
Well, today, we are going to dive into how to turn that data into a fascinating story about your health.
Ooh.
We're going to explore how AI can unlock these secrets hiding in plain sight, using a research paper that guides us through analyzing real smartwatch data with the help of, Google's AI tools. Bard and Colab.
It's like having a personal health detective, right? Like
Yeah.
on your wrist. We often just glance at our heart rate
Right. Yeah.
or step count,
Mhm.
but this deep dive is about connecting the dots to reveal those aha moments you wouldn't catch otherwise.
Okay, let's unpack this. The research paper breaks it down into 3 steps: cleaning, analyzing, and visualizing your data.
Okay.
And the coolest part, Bard, this super smart AI, can help us with each step. So no data science degree needed.
I know, it's really exciting. I mean, what's really exciting is how accessible this is becoming.
Yeah.
The paper emphasizes that anyone, even without a tech background, can follow along and analyze their own data. It's about empowering individuals to understand their health better.
I love that.
Yeah.
Right, so the paper starts with a real-world example, showing us how Bard tackles a messy set of smartwatch readings. Things like blood pressure, pulse, temperature, all the good stuff. But there's a catch. The initial data is, all over the place.
Yeah.
We're talking typos, missing values, even a pulse rate that would make a marathon runner jealous.
Exactly. That highlights a crucial point. The quality of your analysis depends on the quality of your data. If you start with messy data, you'll get messy insights. So cleaning things up is essential.
And that's where Bard comes in, right? It's like having a superpowered data janitor.
Mm-hmm.
That not only spots these errors, but also intelligently corrects them. For instance, it sees a temperature of 372.0
Yeah.
and knows, hey, that decimal point's just hanging out in the wrong spot. It should be 37.2, a much more realistic human temperature. It's not just blindly following rules. It's using reasoning to make sense of the mess.
Exactly. And that's a big leap in AI capabilities, right?
Right.
It's using context and understanding to fix errors, not just applying a set of pre-programmed instructions.
So once Bard has cleaned up the data, it's ready for step 2, analysis. And Bard immediately spots something interesting. February 5th, 2020. This day sticks out because the readings are, all over the map.
Okay.
We see high blood pressure, low heart rate, low temperature, and a breathing rate that's through the roof. What's going on here?
Now, this is where the magic of AI really shines. Bard can pick up on these patterns, those subtle correlations that we might miss just by looking at the numbers. It flags this day as potentially concerning, suggesting there might be something, worth investigating further.
It's like Bard is saying, hey, on February 5th, something was off.
Right.
Maybe an infection, maybe a stressful event, maybe even something like sleep apnea. This is worth a second look. And that's a huge help because, let's be honest, who remembers exactly how they felt on a random day 2 years ago?
Right, and that's a key takeaway for, you listening.
Yeah.
Imagine Bard analyzing your smartwatch data and pointing out specific days or weeks where your body might be telling a story you didn't even realize was there. It's not about self-diagnosing, but about having more data points to discuss with your doctor, potentially catching things earlier.
Okay, so we've cleaned the data, we've analyzed it. Now comes the fun part, right? Making it visual. And guess what? Bard can even generate the code needed to create charts and graphs of your data. Now, I know code sounds intimidating.
Yeah, it sounds very technical.
Yeah.
But think of it like this. Bard speaks the language of computers.
Uh-huh.
That's the code part. And it tells another program called Colab how to draw your health story.
Yeah.
So you get these beautiful visualizations without needing to learn any programming yourself.
Exactly. It's like translating Bard's insights into something we can easily understand.
Right.
And the paper actually includes an example of a line graph Bard created showing all the different vital signs plotted over time.
Yeah, and what's fascinating is how much the visual adds to the story. We see the initial high blood pressure and pulse gradually decrease over time.
Yeah.
Oxygen levels remain stable, but that breathing rate, well, this seems to be on an upward trend.
And remember, February 5th, the day that stood out in the analysis. Well, you can clearly see a dip in temperature and that spike in breathing rate right there on the graph. It brings it all together.
Imagine having this kind of graph for your own smartwatch data, right?
Right.
Seeing your own ups and downs, your own patterns. It's like having a personalized health map, showing you trends you might never have noticed otherwise.
It's like your own body is sending you secret messages, and now we have the tools to, decode them.
That's a great way to put it. It's about moving beyond just collecting data to actually understanding and using it to improve our well-being.
Okay, so we've seen how Bard can clean, analyze, and even visualize smartwatch data. Pretty impressive, right?
Yeah.
But I want to know, what does this mean for us in the bigger picture? Where does AI fit into the future of healthcare?
It's like stepping into a whole new era of like personalized medicine, where we have the power to understand our bodies, on a deeper level.
Wait, I have to admit this is like blowing my mind a little bit, but let's zoom out for a second and think about the real-world impact. What does having this kind of personalized data analysis, mean for the future of healthcare? I mean, is this like the end of going to the doctor?
Well, not quite. It's not about replacing doctors, but about giving them a powerful new tool, right? Imagine a doctor who has access not just to your, medical records, but also to years of your smartwatch data. They'd have a much more complete picture of your health.
So instead of just relying on what we tell them, they'd have actual data to back it up.
Yeah.
Because let's face it, my memory of how much I slept last month is probably not the most reliable source of information.
Exactly. And think about it. AI can analyze that data and flag potential issues that might otherwise slip through the cracks. It's like having an extra set of eyes constantly scanning for patterns and anomalies.
Okay, that's pretty amazing. But I also have to ask, what about the potential downsides? Are there any risks we should be aware of with all this data analysis? I mean, it sounds a bit like, Big Brother, right?
Yeah, it's true that any new technology comes with potential risks. That's why it's, crucial to have open conversations about data privacy and security. Users need to understand what data is being collected, how it's being used, and who has access to it. Transparency is key.
So it's not just about the tech itself, but about making sure it's used ethically and responsibly. We need to make sure people feel comfortable and in control of their own data. I think that's something a lot of people worry about.
Absolutely. And that's a conversation we need to keep having as these technologies evolve. But focusing on the positive for a moment, one of the most exciting aspects is the shift towards preventative care. Instead of just reacting to health problems when they arise, we can use this data to identify potential risks early on.
So instead of waiting until we're sick to see a doctor, we can use this data to make healthier choices every day. It's like being proactive about our health instead of reactive. I like that.
Yeah, it's about becoming more informed participants in our own health journey. Imagine a world where your smartwatch data is seamlessly integrated with your, electronic health record, providing your doctor with a comprehensive view of your health over time.
That would be a game changer. No more relying on our sometimes faulty memories to, tell the doctor what's been going on. They'd have the data right there in front of them.
Precisely. And with AI helping to analyze that data, it could flag potential issues that might otherwise be missed, leading to earlier diagnoses and more effective treatments. But even with all this exciting potential, we can't forget the human element. We still need doctors, nurses, and other healthcare professionals to guide us.
It's not about replacing human expertise. It's about giving those experts more information to work with.
Exactly. Think of it as a partnership between human intelligence and artificial intelligence, working together to improve health outcomes.
Okay, so we've talked about the potential benefits, but what about the potential downsides? Are there any risks we should be aware of?
One risk is over-reliance on the data. It's important to remember that these AI tools are just tools. They're not a substitute for professional medical advice. We shouldn't jump to conclusions based solely on what our smartwatch tells us.
Right. It's about using the data as a guide, not a diagnosis. It's like the data might suggest something, but you still need a doctor to interpret it and figure out what it really means.
Precisely. And it's also important to remember that AI is still under development. There's a lot of research happening, a lot of progress being made, but there are still limitations to what these tools can do.
So we need to be realistic about what AI can and can't do. It's a powerful tool, but it's not a magic bullet. It's not going to solve all of our health problems overnight.
Exactly. It's about using these tools wisely and understanding their limitations. And as with any new technology, we need to be mindful of potential unintended consequences.
Okay, so we need to be cautious, but also optimistic. There's a lot to be excited about.
Yeah.
But before we get carried away with all the future possibilities, let's bring it back to the present.
Right. Let's remind ourselves that these tools are available right now. You don't have to wait for some, futuristic scenario to start exploring the power of analyzing your own health data.
Exactly. The resources we've discussed today, like Google's Bard and Colab, are accessible to anyone with an internet connection. So what are you waiting for?
Go forth and discover the hidden stories in your own data. You might be surprised by what you find.
I love that. And who knows, maybe you'll even uncover some insights that could improve your health and well-being. It's all about taking control of your health journey and using these amazing tools to your advantage.
That's what this is all about. Empowerment through knowledge and technology.
All right, before we wrap up completely, I have one final thought-provoking question for our listeners. We've been talking about analyzing data from smartwatches, but what about other sources of health data? Things like fitness trackers, sleep apps, even our phones, they're all collecting information about us. It's like our digital lives are creating this whole other, like, parallel health record. And I wonder if we can tap into that.
Yeah, that's a great point. It's not just smartwatches, right? We've got fitness trackers, sleep apps. I mean, even our phones are tracking our movements and habits. All this data is like a gold mine, just waiting to be explored.
So instead of these separate apps and devices, it's all connected and talking to each other, kind of like a personal health data ecosystem.
Exactly. Imagine all these data streams coming together, painting this comprehensive picture of your, well-being. And with AI helping to analyze it all, the insights could be incredible.
Wow, okay, that's like next level. But let's not forget about the human element in all this. Even with all this data and tech, we still need, doctors and nurses and other healthcare professionals,
Well,
right?
absolutely. This technology isn't meant to replace, healthcare providers. Think of it more like giving them superpowers. Imagine a doctor having access not just to your medical records, but also, years of data from your smartwatch, your fitness tracker, and other sources. They'd have a much deeper understanding of your health and be able to provide even more personalized care.
That's a really exciting vision for the future of healthcare. It feels like we're on the verge of something truly transformative.
We are, and it's up to all of us, patients, providers, developers, policymakers, to, shape this future in a way that benefits everyone. This is where it gets really interesting. It's not just about the technology, it's about how we use it to improve lives.
So it's a collaborative effort. We need to work together to make sure this tech is used responsibly, ethically.
Exactly. And that includes having, open and honest conversations about data privacy, security, and access. We need to build trust and ensure people feel comfortable and in control of their own health data.
Okay, well, I think we've given our listeners a lot to chew on today, from the, nuts and bolts of data cleaning to the bigger picture of AI in healthcare. Any final thoughts before we wrap up?
Just this. Don't underestimate the power of your own data, right? It's a treasure trove of information just waiting to be discovered. So be curious, be proactive, and explore the tools and resources available to you. You might be amazed by what you find.
I couldn't have said it better myself. All right, that's it for today's deep dive into the world of smartwatch data secrets. We've seen how AI can help us unlock those hidden patterns and turn, raw data into meaningful insights. But remember, this is just the beginning.
The future of personalized healthcare is unfolding right before our eyes, and it's an exciting time to be a part of it.
We'll see you next time for another fascinating exploration of the cutting edge of technology and data. Until then, keep exploring, keep learning, and keep asking those thought-provoking questions.